Good morning, everybody. This is Tom Love from PolicyMap, and thank you for joining me today for the PolicyMap overview for the leadership teams of OCCP and NJCEED. We'll wait just a couple more minutes for a few more attendees to join, but while we do that, I'll just explain that this is a webinar format today, meaning that this is listen-only mode. You can type questions as you go in the question panel on the right-hand side. And my colleague Brian Blacker is sitting with me and monitoring questions as well. So we can respond to the questions as you ask them, and we can also follow up with questions after the session. So we will have a listing of all the attendees and the questions as well that we can follow up afterwards. Okay, so I guess we'll get started. We've got quite a good gathering here ready to go, so I don't want to delay you. And again, this session will be recorded, so anybody that has come in late or has missed a session, we'll send out a link to the full recording afterwards. So again, this is the PolicyMap overview for the leadership teams of the New Jersey Office of Cancer Control and Prevention grantees, and also guest invitees from New Jersey Cancer Education Early Detection Program, NJCEED, and other organizations as well. Just some quick introductions here. My name's Tom Love. I'm with PolicyMap, and my colleague Brian Blacker is our data analyst from our data team, and he is the assigned point of contact for the OCCP grantee users who've been set up for PolicyMap. As you can see from the area code, we're located in Philadelphia. In Center City. I'm actually a proud New Jersey resident myself. I live in Cherry Hill, so I'm actually very excited to be involved in this important program. You'll see that we do have also additional support links, and I will refer to these as well during the session. So we've got a email address, info@policymap.com. We also have a phone number you can call, which is manned by live people from 9 till 5:30 Monday through Fridays. And also a variety of tutorials and guides covering everything that you'll see today. And before we get started, I wanted to give special thanks to a couple folks, not to put you on the spot, but Anindita Fahad from the New Jersey Department of Health, OCCP, for coordinating this and for bringing us into this whole program and providing access to PolicyMap for the OCCP grantees. And also Jackie Miller, who was gracious enough to provide the contracting through Virtua. And that was, believe me, quite amount of work on her part. So we really appreciate that. Just a quick agenda today. First, I'll go through the background of who the NJ OCCP grantees are that would have access to PolicyMap, although you pretty much have a good idea who you are already, followed by a general overview of PolicyMap. This is a follow-up to our earlier meeting back in mid-October at the American Cancer Society in North Brunswick, where I was invited to do a very quick overview of PolicyMap as part of your day-long agenda. So today we actually have 2 hours scheduled. I doubt that we'd go much more beyond an hour, but we do have plenty of time for Q&A if we need that. But you'll see that there are a variety of features in PolicyMap we'll cover today. Maps, data that's in PolicyMap. You'll see that in addition to all the data that's already in PolicyMap, you have the ability to upload your own data into the tool. So for instance, partner organizations or partners in your coalitions. You'll see that you can generate instant reports on any areas that you click or draw on the map. You can see data tabularly as well as geospatially. So we have something called tables to do that. You see we have a function called 3-layer maps, which allows you to find hotspots or target areas for multiple criterias that you specify, such as income, health, and education. And then ways to share or save your maps, how to download information from PolicyMap. So just a brief overview of NJCEED, and again, NJCEED and other organizations, we're more than happy to set up separate go-to meetings or in-person meetings and trials to introduce you to PolicyMap as well. But for the current program, it's a PolicyMap subscription for 10 users, which is being shared by 10 grantees from OCCP. Each of the grantees come from different types of organizations, such as hospitals, county health departments, foundations, and each organization has a individual that's assigned a PolicyMap ID and is representing a 2-county area, with the exception of Inspira, South Jersey, which has a 3-county area. So you can see we've got the Bergen County Department of Health, which covers the Bergen-Hudson area, the Community Medical Foundation in Toms River, which covers Ocean Monmouth, and so on. Essex Passaic Wellness Coalition, Dan Rosenblum is a slight exception because he already has access to PolicyMap through Rutgers University subscription. So he's not one of the 10 users, but he has access through Rutgers. And then you can see the rest of the grantees listed here. Continuing on the second page, the list continues. And you'll see in PolicyMap, you can create your own custom regions for your 2-county areas. And I've done that as an example as well. Last but not least, the 10th ID, since Dan has access through Rutgers, is Anandita's access as well through NJCEED. But it's actually great to see this mix of different types of organizations working together to form coalitions in these areas, different varieties of organizations as well. So some of you are already familiar with PolicyMap from our last meeting back in October. I know some of you are already asking for access before the access period. The access period for OCCD started officially yesterday, January 15th, so runs through January 15th, 2019. Although we did set up access a little early since we were able to get the agreement back a couple weeks early. But for those of you who are not familiar with PolicyMap, it's an online tool. It's a geographic information system tool, or GIS, used to understand communities you serve visually on a map. So think of like a Google Map, but much more advanced, with a lot more data, but hopefully is easy to use. It's accessed through our website, policymap.com. It's a subscription, so when you're at the website, you are issued an ID and password to log in and use the tool. Again, it's designed to be kind of a GIS for non-GIS experts tool. And you'll see that there's a tremendous amount of data already in PolicyMap. We've got tens of thousands of data layers grouped into different categories that you'll see, such as demographics, health, housing, income, education, quality of life, federal programs, among other areas. It's used by many thousands of organizations. Examples are local, state, and FedGov. So examples in New Jersey are, of course, New Jersey Department of Health now, the New Jersey Economic Development Authority, the New Jersey Department of Community Affairs are all subscribers. Many universities, so in New Jersey, examples of those are Rutgers, Rowan, Seton Hall, Princeton, and Rider universities. So if you know anybody that works at one of those universities, you may well let them know that they have access to this as well. Again, a reminder for those that have not been issued access already, we do offer free trials. We can set up a more informal go-to meeting rather than this webinar format to walk you through the tool on an informal basis. So at this point, I'm going to actually just go live and show you PolicyMap. So let me just switch to the browser. Okay. So you'll see that our website is policymap.com. With your login, you'll see on the upper right is the login button. But before I actually log in, I want to show you some resources that are available on our website. Under resources, we have, first of all, a blog. This has interesting updates, features, and spotlights on data sets that have been updated, new data sets. If you go into the blog site, you'll see, for example, we've just added a blog posting for a new data set we've added last week covering advanced practice nurse data. If you click on any of these articles, you'll be taken to the article itself. In this case, it talks about different types of nursing roles in this category, and you'll see within any of these blog postings is an interactive map. This is one example of how you can create a map in PolicyMap. And in your case, it would be zoomed in more to a local area like a county or even a city or even a neighborhood. And then you can save that map and embed it on a website into an e-newsletter like this to tell a story. But we have a variety of interesting articles you can find on our blog website here. Under support, you'll see, and this is also linked within the login site as well. Everything that we cover today, you'll see a brief tutorial or guide in the support page. And also of particular interest are short videos. So you'll see that there is a video training gallery. These are short 3-4 minute videos covering different aspects of PolicyMap. The best place to start, of course, is called the PolicyMap Quick Start Guide, but you'll see other videos as well, such as the 3-layer maps tutorial, how to download data from PolicyMap, how to upload data. Okay, so I'll go ahead and log in at this point. And I'm actually working at a different keyboard here. So bear with me. Okay. So when you log into PolicyMap, you'll see that you are looking at a map of the United States because this is a nationwide tool. So every time you load a data set onto PolicyMap, even though you're zoomed in New Jersey, you can you're loading for the entire country at once. So you can actually compare statistics from New Jersey to other parts of the country. You'll see that we are in the Maps page. On the upper left, you'll see Maps is highlighted. This allows you to view one data layer at a time, such as income or poverty or cancer by type. There's also tables, the ability to compare geographies side by side. So if you wanted to compare breast cancer rates among counties in New Jersey or other states, you can do that. You'll see that there are 4 different types of reports in PolicyMap right now that you can generate on any area, one of which would be of particular interest to you right now, which is the community profile report. We will be adding, we're actually very excited to announce that we'll be adding a health report to PolicyMap as well, which is due to be launched by the end of Q1 this year. And so you'll be sent a notification when that happens. 3-layer maps, again, is where you can find areas that meet multiple criteria that you specify on the map. And finally, although there's a lot of data in PolicyMap, there's also your data that's not there. So you have the ability to upload your own data points or address-based locations into PolicyMap, which are then stored here under My Data, which you can then view against PolicyMap data sets. There's a location bar. So here on the upper right is our data directory. So again, we have thousands of data indicators in PolicyMap. This data directory lists them, has detailed descriptions about each one, where the data is coming from, and the geography to which that data is available. Is it available at a census block group level? Is it available at a census tract level, a zip code, a county, a state? There's a feedback button on the upper right, and then also that same support page that I showed you earlier is linked here from the login page as well. So in the location bar, you could type in just like Google Maps, you could type in a street address, you could type in a zip code, you could type in a county and zoom to that part of the country. So for instance, if I just type in New Jersey, it takes me to New Jersey. You can grab the map with your mouse, you can zoom and drag the map either using the zoom bar on the right or just using your mouse wheel. And you could zoom in to a specific city. So let me just start by going to, let's say, New Brunswick. Okay, so you can see now we're actually taken down to a local level in New Brunswick. Once you are zoomed into an area that you like, you can see all the data in PolicyMap is organized in these menus you see across the top of the page. And all these menus are organized in the same way. So you can see demographics, income, housing, lending, quality of life, the economy, education, health, federal guidelines, and analytics. If you click on any of these categories, for example, demographics, you'll see that there are subcategories of data. You can look at population, population density, and then as you continue to mouse through, you can see race, and then submenus for race, ethnicity, and so forth. You can look at age, population by sex, people with disabilities, in terms of their age, in terms of their employment status, in terms of their income. You can look at veterans who've served in particular wars, or veterans by poverty status. You can look at languages spoken at home, foreign-born populations, types of households. Are they single female-headed households with children? Election data, religion data. So all these menus are organized in the same way. And just to show you initially how a data layer works, let's go to the Income tab. And let's look at just generally, so here you can see under income, people in poverty, by age, by race, by veteran status, families in poverty, persistent poverty areas. We have federal tax return data, so which areas are claiming more child care tax credits or tuition credits, things like that. We have information on WIC programs, free and reduced school lunch programs. Let's look at, as an example, just household income, and let's look at all households. So you can see it's immediate. The tool is very fast. You can see that there's a map title. We're looking at the estimated typical median household income. This is from, you'll see in the legend, from the census. The census has an annual American Community Survey data, which has just been updated to 2016, which is the most current. You have the option of changing the year of data. But right now we're looking at percentage of our median income of a household. You can click on the map title. This gives you more information about this data layer. And you can click to the data directory to see more detailed information about this particular data layer and its source. So you can see in the legend that we're zoomed in pretty far. So you can see we're looking at block group level data. You can see from the legend, the darker block group areas are higher income areas. The lighter block group areas are the lower income areas. And if you click on any of the area, you'll see, for instance, let's click on this area right here. Gives you the income for this block group and how it compares up to the nation. So this block group income, median household income is $20,000 compared to median household income for New Brunswick, which is $40,000, compared to Middlesex County, which is $80,000, compared to New Jersey, which is $73,000, the US, which is $55,000. So you can see this area is a higher poverty area than the larger areas in which it sits. You can see in the legend, that there's a variable section. So in this case, if you click on the variable, you can see change over time. So in this case, you can see percentage-wise how has income changed since 2000 or in the past 5 years. So let's change this to income change since 2000. So now you can see the map title says percent change in income since 2000. You can see looks like all areas have increased, but some areas have increased at a much slower rate than others. The yellow areas income has increased 1.68% or less. So if I click on this area here, you can see actually this area has decreased in income since 2000. So you can look at different aspects of this community using different data layers. Another example under demographics, another way to get a quick snapshot of race, ethnicity of an area is under demographics. There is a diversity link, and here you can look at predominant race or ethnicity. So now you can see very quickly at a glance in New Brunswick, the concentrations, looking at the legend, the red areas are the Hispanic population. The blue areas are African American population. The green are white population. Blue, kind of this lavender color is the Asian population. If you scroll down here in the legend, the degree to which that is the predominant race or ethnicity is how dark the color is in this case. So you can click on the map and see this area is over 90% Hispanic population. So these are data layers. They all function the same way. Going over to some of these other tabs here, you can see under, let's go to the health tab. We have chronic conditions. Some of this data is census tract level data. Some of this data is county level data. Under cancer, we've got cancers, all cancers or cancer by type. Cancer data for the most part is county level data. So you can view that on a map or you can view that in a table, and I'll show you how that works as well. But you'll see in most of these menus, the first two columns are data layers, and then the third column are data points. Data points are specific locations of different facilities, hospitals, nursing facilities, nurse practitioner-led clinics, community health centers and lookalikes, mental health treatment facilities, drug and alcohol treatment facilities, and then from a healthy food access standpoint, retail locations, farmers markets, SNAP retail, and we've done a nationwide analysis of limited supermarket access areas as well. But let's just show you how data points work. So on top of this map, let's look at community health centers and lookalikes. So here you can see we've got this predominant Hispanic area, and then you can see we've got community health centers and lookalikes. This is from HRSA. You can click on any of these and see information about each of these health facilities. You can also put on here hospitals. So here you can see also from HRSA, here's Children's Specialized Hospital. And we have information on number of beds, staffing information, and also Robert Wood Johnson University Hospital as well. So let's say that we wanted to take a look at this area here as a whole. You'll see on the bottom of the map, there's a create button to create a custom region. So you can actually draw, so backing up here, you can actually create or draw a custom region on the map. or assemble geographies like census tracts or zip codes or counties, or do a report on a radius within a specific address, such as a hospital or a clinic or a school. Before I do that, let's put one more data layer on here. Let's put on here under education, we have all your public school data as well. So this is from NCEED, the National Center for Education Statistics. So these are all of your public schools. If I click on one of these, you can see here's a charter school. We have information on how many students there are per grade, demographics of the students. So you can see we already know this is a Hispanic area. And here you can see that the vast majority of students in this charter school are Hispanic. So let's say I wanted to create a custom region on this area. I can click create. And in this example, I'll just draw on the map. So I'll just say, draw the custom region. So what you can do is just click. This is not a very precise example, but just to show you the functionality. And let's call this and you can put some details in here if you wanted to. Save this. So you can see that this is now stored. If I click on the bottom here under my custom regions, you'll see that there's a little icon on the corner of your custom region. You can click on this, and first of all, if you wanted to see all the data on all the schools that are currently sitting in this custom region, you can click on the See List of Public Schools. It pulls up all of this data about all those schools in this table, which you could then click on this download button to export this as an Excel document. You can also get a report on this area. So if I click here, get report. So as I mentioned, there are 4 different types of reports. I think the one that you'd be most interested in right now is the community profile, and then certainly when we add the health report, that would be of utmost interest to you. So just to show you the community profile report, which you have access to now, it defaults to the custom region that I've created, New Brunswick Hispanic population. I'm going to preview my report area and generate my report. So the report pops up. It shows you the political representation of the area. It shows you the population trend. So we already know this is heavily Hispanic. You can see the population is also rapidly growing in this area. It's grown 17% since 2000, compared to 10% for Middlesex County and 5% for the state of New Jersey. Here's your race ethnicity breakdown. So 71% Hispanic, 13% African American, and so on. 78% Hispanic population in this area. Here's your population by age. So you can see in this area, percentage-wise, has a much higher population of under 5 and a much higher percentage population under 18 compared to the state. Pretty much along lines of the state in terms of working age population, and a lower 65 plus population compared to the state. You can see the income breakdown in this area. So 32% of the households in this area make less than $25,000 per year, or 2,300 households, compared to 14% for the state. I'm sorry, the county, and 17% for the state. Under immigration, you can see that 13,000 people, or 47% of the population, is foreign born. We also have information on green card grantees for the state of New Jersey. So there were 49,000 granted legal permanent status in 2015, or 4% of all green cards issued for the nation. Types of families in this area. So there's 1,400 single female-headed households with children, or 26%. Housing information, so it looks like it's even split between single-family homes and small apartment buildings, people living in this area. In this area, only 24% or 1,700 households own their own home. And we have information on vacant households in this area. There's 95 vacant residents in this area as of Q3 2017. We have employment data from the Bureau of Labor Statistics. This is updated every month, so the most current we have is November 2017. Not down to the neighborhood level, but citywide for New Brunswick and the county, the metro, and the state area. So we have count and percent of unemployed. Types of jobs people have that live in this area. A lot of food service, accommodations, administrative waste management services, manufacturing workers in this area. And then crime data from the FBI. And this is crime rates per 100,000 by crime type for this area. So the healthcare report, which will be added, will actually be much more interactive than this. This is kind of a static report, and the new report will have sections that you'll be able to export. There will be a lot more charting, a lot more interactive charts, and the ability to download lists of data from different sections of the report as well. Okay. So that's the first example. Another example that I have, so another trick here is if you want to just clear the map completely and start over, on the bottom right, there's a reset map button or link. So you click on this, it will clear everything out and take you back out the United States. And let's say for this example now, we'd like to go to Atlantic City. So I was just playing around with a couple scenarios, and I found this one interesting in Atlantic City. So under the Health tab, we have the chronic conditions, the health status, we have vital statistics. We have health insurance. So we have health insured and uninsured populations. We have Medicare information, Medicare beneficiaries, Medicare utilization. Under the healthcare insured and uninsured, we have uninsured by race, by income, by employment. Let's just look at total uninsured. And so you can see now we're looking at the percent of people without health insurance in the Atlantic City area. You can see this is by census tract. And another functionality is if you wanted to see where the actual census tract boundaries were, on the bottom of the map, there's a map boundaries link. If you click on this, you can overlay different boundaries like zip codes or counties or states. There are options for census tracts. Census tract boundaries are updated every 10 years. So the most current census tract boundaries we have are from 2010. And so here you can see the actual census tract boundaries. And you can see we're looking at percentage of uninsured population in the Atlantic City area. If I click on a census tract, you can see here's an area where 35% of the population is without health insurance. You can change the variable in this case from percent to estimated number of people. So the map becomes a little more apparent. We're now looking at estimated number of people without health insurance. And you can see that there are 3 census tracts here that kind of jump out in terms of absolute numbers of uninsured. So this census tract has 1,191. This census tract has 1,477. As does, actually, this is all the same census tracts. There's 2 census tracts here, not 3. So you can look at this in terms of what assets are available in the area. Under health again, let's put our health centers back on here. You can see our health centers all seem to be lined up further east or northeast. So here's the Atlantic Care Health Services site. Here's Atlantic City, New Jersey family site. When you have data points, you can also filter these. So you can filter or color code by operating hours per week. Do they service migrant workers or residents? Community health, is it community health? Is it public housing site? Is it, is it a mobile van? Is it a permanent site? Is it a health center applicant? Is it a contractor operating this? So all of these you can filter or color code. So let's look at something like operating hours per week, color coded. So here you can see there's these 3 health centers. There's this health center over here that's open 33 to 40 hours per week, and then these 3 are open 41 to 99 hours. This one here is open less than 33 hours per week, Atlantic Care Health Services Covenant House. And then you can put your hospitals on here. There we go. So here we have the Acuity Hospital of New Jersey, etc. So I actually, before the call, I did run a community profile report on this area, similar to the one I showed you for New Brunswick, and I did see that the vast majority of people that live here rent, they don't own. So another aspect that you can look at perhaps is under housing. Under housing, we have cost burden data under affordability, and you could have renter cost burdens in terms of, are they cost burden or extremely cost burdened? Extremely cost burdened is where they're paying at least half their income, 50% of their income towards rent. So if I change this back to number, you can see in this area here, if I change this back to percent, 53% of households in this area are paying at least 50% of their income towards rent. So you're just something to look at in terms of the more they're spending on housing, the less resources they have to spend on healthcare. And perhaps you can work with local housing partners to help address that aspect of the population. Okay, so that's the way data layers and data points work. If I wanted to save this map on the upper right, let's say you wanted to save this map as a visual. Let's change this back to our uninsured health example, which is a little more compelling. And so let's say you wanted to save this map as a visual. You can, oddly enough, it's called print. On the upper right here, you'll see a print icon. When I click on this print icon, it puts you into a print preview window. So you can reposition the map, you can zoom it in further, and then you can change the text size using the guides here on the left. So you can save it as a PDF or PNG file. More options, you can include the data layer description. So you can see we've added the data layer description up here. You can even change your title. And so you can see the title's changed up here in the actual map itself. And then when you're ready, you can export this as an image. And when the map is ready, it will pop up in your browser as a PDF file in this case. You can download data from PolicyMap. So here is the next link is a download arrow. So here you can export data. If you just want to export a listing of all the census tract in Atlantic City with the value of number of people without health insurance in each census tract, you can do that. In this case, we have the community health centers and hospitals on the page, so you can download their locations if you wanted to, or a combination. wherever there is a community health center, how many people around that health center do not have health insurance. So you can download a combination of values. When you click next, let me move this out of the way here. You can add your location. So you could say, I would like to see Atlantic City. And it'll ask you what geography would you like. So would you like census tract? Would you like zip code level totals for uninsured health, city levels, county subdivisions, and then confirm your download. And they'll come back and say, this is what we're going to download for you. Estimated number of people without health insurance for community health centers and lookalikes by census tract in Atlantic City, New Jersey. And it'll export that list for you. Here's my map that I saved. It popped up and said my map image file is ready. So let me just go ahead and, I should have opened that. But that's how it appears when it pops up in your browser. Okay. So let me reset my map again. So examples of custom regions. So also before the call, what I did was, as an example, under my custom regions, I created a custom region for each of the 2 states, except for Salem, Gloucester, and I can't recall the 3rd county. So here I've created custom regions for each of these. So here is Burlington, Camden, here's Sussex, Warren, here's Atlantic Cape May, here's Middlesex, Union, Cumberland, Gloucester, Mercer, Hunterdon, Mercer, I think I got one of those wrong, Essex, Passaic, Ocean, Monmouth, Bergen, Hudson. So when you create custom regions, again, you have this little icon. So here is the New Jersey OCCP team for Sussex, Warren counties, Sussex County Department of Environmental Health, contact name. Here you can change the colors of the custom regions. You can also add a fill. You can click on this little paint canister and create your own transparency. And you can get a report on this whole 2-county area if you'd like, the same report that I showed you before. There it goes. My mouse just stopped working there for a second. And then also, again, if you overlay different things, like I want to see under the health tab, I want to see all the health centers in my 2-county area, community health centers and lookalikes. You can do that. So for example, if I click on Essex Passaic, you'll see list of community health centers and lookalikes. And this will pull up all the data on all of those centers in your area. So all this functionality also applies to data points that you upload yourself. So we have a spreadsheet data loader. You'll see on the top here, there's a data loader link. And you can upload very large spreadsheets, up to 10,000 rows of data. So again, this could be locations of partner organizations that you're working with within your 2-county area, or any other address-based information. You can upload in a spreadsheet of up to 10,000 rows at a time in columns of up to, spreadsheets with up to 45 columns of data. So here, for example, I've clicked on a health center in Morristown, and all this data related to this health center, if you can imagine, is the equivalent of 1 row on a spreadsheet. So what I've done in advance of this call is created a listing of basically the organizations where each of the users are represented for this PolicyMap access under OCCP. So we've got this list of 10 organizations here. I've just created this very simple spreadsheet which has the, I call it grantee, but the organization name, the address, city, state, and zip code. So again, you could have up to 40 columns of related information. So what type of program, what's their contact information, maybe information about grants they're operating under, number of clients seen, information like that. You can put into a spreadsheet and then upload it into PolicyMap. So I'll go through the process of uploading this very small spreadsheet to show you how it works. The only required fields, and again, there's a tutorial that covers this as well, are address, city, state, and zip code in order for PolicyMap to be able to geocode the data and put it on the map for you. So having the spreadsheet created in advance, I will close this out. I'm going to save this because I'm not sure where Phil saved this. Here. So I'm just going to save this somewhere so I can find it. It needs to be saved as a CSV file. Okay, so now I'm going to clear all this off my map here, and I'm going to actually just reset my map again and go back to New Jersey. So now I go to Data Loader, and you'll be walked through the process. So you can either add points one at a time, which you probably would never want to do, or upload the spreadsheet of points that you prepared in advance. So I'm going to call this you'd probably always want to start by making this available to yourself only. You then have the ability, once it's fine-tuned, to share this with specific individuals or make it publicly shareable. You can choose your icons. So let's say we'd like this to be circles that are medium size and green, and then find your file. Found the file. Okay. So you find your file and then import your spreadsheet. So here it identifies the columns I have in this very simple spreadsheet. And then you click Next on the button on the bottom right, and you'll see that it has found successfully 10 out of 10 points successfully geocoded. So if you have any addresses that have failed, for example, if it's a post office address or an incomplete address such as Broad and Elm Street, this would appear red in the first column, and you could sort these to see which have failed. You can group the red indicators together. On the upper right, if you have a data set of less than 250 points, you can also display a certain field if you zoom in far enough. So let's say if I zoom in far enough, I'd like the grantee name to appear. Save and close. And there's a preview window. I'm going to save this and load this onto my maps page. So now you can see under My Data, here if you click on the upper left under My Data, you'll see the data set is found here. And so now if I zoom in, you can see here is the Community Medical Center Foundation, and so on. So you could zoom over to Marlton, New Jersey, and you can see down here on Route 73 is the Virtua Cancer Center. And so at this point, you can overlay this data against any PolicyMap data as well. So in this case, you could say, let's look at this and view it against, again, under health, let's look at our insured population again. So you can see we're looking at percentage of all people without health insurance. Here is the virtual location, which sits in this census tract, very oddly shaped census tract, where it's pretty low uninsured population, but then immediately to the east is this area where it's a slightly higher percentage-wise people without health insurance. And you can, again, click on this and you can generate a report on this area or download statistics about this area. Or again, change this from percent to number. If I change this to number, clicking on the same area, I can see there's 663 without health insurance. Okay. If I go back to the state level, I'm going to zoom back out to the state because I want to show you some of the cancer data sets. And most of those are county level data. So under health, again, we've got first column, cancer, all cancers or by type. Let's just start with all. And you can see that it's annual incidents per 100,000 persons as of 2010 to 2014. This is from the CDC. You can see from the legend that it's only available in county level or state level. It's kind of hard to see the differentiation with the counties here, but you can, under the legend, you can change the color ramp of the map to make it maybe a little easier to see. You can change it to a brighter color and then overlay this data layer with the map boundaries for counties. So you can see here's Burlington, here's Camden, here's Gloucester, here's Atlantic. And you can see that the map legend shows a rate, it maxes out at 482 or more per 100,000. If I click on any area, so if I click on Mercer County, you can see the rate is 495. If I click on Burlington, you can see the rate is 523. Camden is 513. So another feature to show you in the legend is you can edit these ranges, and this applies to any data layer in PolicyMap. So if you click on edit ranges, you can change the cut points on the map. So you could say, I don't know, let's say we don't need 5 ranges, we only need 4 ranges. And let's say 450, 475. So you can see the map changes based on the new ranges. So you can see that this kind of shows that the central and south end of the state has a slightly higher rate of all cancer compared to the north. Of course, you can also change this to number, in which case it'll be a completely different story. So if I click on Mercer, the number's 2018 versus in New Jersey, it's 48,000. In the United States, 1.5 million. So in a case like this, and of course you can see we still have our grantee locations overlaid. But in this case, if you wanted to see just different county statistics where data is only county level, you might want to go to tables, which is in the upper left here. So let's go there now. So in tables, all the menus across the top are exactly the same. The difference now, of course, is you're in a table instead of in a maps view. So you can still type in the location. So let's say we want to see New Jersey. And you can see it's carried over our cancer data set from the maps page. And you can see we're looking at count. There's that 48,693 number for New Jersey. And here you can actually see the values for each county. So instead of clicking on each county on the maps page, you can simply download the values here. You can also see a ranking by states. So we're ranked 10th out of 51. And you can compare this with other states. You could say Pennsylvania. You could say New York. Delaware. Connecticut. So you can just keep adding to this if you wanted to. It also has the point data set, which is why there's 0 points for these other states, because I've only uploaded this custom data set for New Jersey. Again, you can see values for all the counties in the other states, or you can change the variable from the estimated number back to the rate. So now we're back to the rate per 100,000. You can see New Jersey, 478 compared to Pennsylvania, 484, New York, 477, Delaware, 495, Connecticut. So pretty much in line with surrounding states. You can also continue to put on data points here. So if you wanted to see under health, all hospitals, or let's say community health centers and lookalikes, you can see if I X out of this layer, 141. If you want to just download a listing of all the health centers and lookalikes in New Jersey, you can do that from here. 293 in Pennsylvania, 743 in New York, and so on. And you can see there's a bar chart also, which shows visually, we're pretty much, I say we because I'm a New Jerseyan also, in line with the other states. And then you can change the data layers just like you would in the maps page. So let's say you want to instead look at under income, let's say people in poverty. So now we've changed the entire table to people in poverty. So you can see New Jersey has a 10% poverty rate, lower poverty rate than surrounding states, except for Connecticut. And rankings for each state. There's also a trend chart in this case because poverty we can compare back to 2000. The cancer rate we only have for the current year. And if you do the checkbox for across years, you can now see a trend chart for poverty in this case. So you could change this again. You could say, okay, let's look at instead, let's look back at our uninsured health population. So now the table is percentage of people without health insurance. So we actually, New Jersey has a higher percentage of people without health insurance versus the other states. And you can see values for those by county. So that's pretty much how tables works. The reports tab. So again, you can run a report directly from the maps page. I showed you an example of that. Or if you want to log in and just do a report on a county or a city, you can go in directly to the reports tab and say, I want to run a report on Newark. And then generate a report on Newark. So you can go directly to the reports tab. Okay, so we've covered maps, tables, and reports. I've shown you briefly the data loader. The missing piece is 3-layer maps. So in 3-layer maps, you can identify up to 3 criteria. Let me just take my data points off here. With 3-layer maps, it's recommended that you zoom in pretty local, so it's not recommended to do a data set that's only county level in 3-layer maps, but you can look at other aspects of communities and on a more localized basis. So let's go back to, let's say, Jersey City. I'm going to get rid of my county boundaries here. So let's say we want to look at something like health. Let's stick with our health insurance indicator. So let's look at uninsured health. So you'll see the maps are the same. The map is completely purple because you see in the legend we're looking at, in this case, if you click on edit layers, we're looking at census tract level data where between 0 and 100% of the population is uninsured. So you can specify, I want to find areas where at least, say 20%. So you can see the map instantly changes to show census tracts where at least 20% of the population is uninsured. So you can use the slider to change this. If I change it back to 15%, you see more areas appear. Let's say in addition to that, under income and spending, let's look at people in poverty. Let's say all, where at least, let's stick with 15% of the population is living in poverty. So you can see the maps show census tracts now that meet both criteria, where at least 15% of the population is uninsured, at least 15% of the population is living in poverty. If you click on any area, here's a census tract where 17% of the population is uninsured and 25% of the population is living in poverty. You can look at a third indicator, such as under demographics. Let's look at foreign-born population. Areas where, in addition to uninsured and in addition to poverty rates, at least 15% of the population is foreign-born. So you can see the data starts to change. And you can see in this area here in Greenville, 20% foreign-born population, 20% people in poverty, 19% uninsured health population. And you can also click on areas that are not shaded to find out why. So this area right next to it is not shaded because only 14.92% of the population is uninsured versus 15.6%. So you can download lists of areas across New Jersey that meet these same criteria that you specify. And you can still also overlay this with the data points, such as where are the hospitals and where are the community health centers. So you can see areas over here where they meet our criteria and there's not an immediate location for a health center. Here's the Metropolitan Family Health Network, which is further northeast from these other areas that might have a certain need. There is under map boundaries, we do also have public transit rail lines. So I'm waiting for that to come back. So we have in this case, the NJT and the PATH transit lines. There could potentially, be the option for us to load New Jersey Transit bus stop data for you. I know there were conversations about one of the criteria is lack of transportation, households that don't own a car, you know, how do they get to the treatment that they need? And so this is another aspect you could look at. Under demographics, we have, might be under quality of life, there's a data layer for vehicle ownership. And if you're not sure, here's another feature. If you're not sure where to find a data set, there is a data button here. This is actually about to be redesigned, so it's a little more obvious. But if you click on data, you could type in a word. And if you're not sure which menu it's under, you can just type in a search and it'll find the data layers for you. Here's estimated average number of vehicles per household. Low income, low access food tracks using vehicles. Number of deaths from motor vehicles, rate of deaths from motor vehicles, etc. So you'd probably be interested in the first one, average number of vehicles per household as a data set. So let's take off the foreign born data layer and let's find this data set again. So let's say where the estimated average number of vehicles in the household is 0. Then that actually wipes it out. But in the maps page, you'll see it's more apparent. Here's average number of vehicles, 1 per household. Let's see, some other functionality is back on the maps page. Okay, so here's, we're looking at a data layer that we have carried over from what we've done in 3-layer maps. People without health insurance, hospitals, community health centers, and lookalikes, NJT lines. So you can, on the upper right here, share this map with somebody else. Oh, I need to get rid of my custom regions. So let's say we want to go to, let's look at Camden, New Jersey. And let's say we want to put on a data layer for under demographics. Let's look at people with disabilities over 65. Let's change our colors back to purple. So we're looking at estimated number of people of 65 or plus with 1 or more disabilities. And let's say you wanted to share this map with somebody else. On the upper right, there's a share icon. And you can email this map to somebody else, enter their email address, put a message in here. This person does not have to be a subscriber to PolicyMap. So what happens, they'll get the email, they'll get a link in the email. When they click on the link, it'll actually put them into the free public version of PolicyMap with this data layer at this zoom level. So they'll be looking at this exact map. If you recall also, in the beginning of the webinar, I showed you the blog page that had all these articles with embedded maps that were live. So if you wanted to embed this map as a live interactive map in a newsletter, you could use the embed feature for that. If you have access to somebody that can update your web page or your e-newsletter, and also share this map through social media as well. And I will pause there for questions. I know Brian's been busily typing responses to questions as they've been coming in. It is about 11:15 now. So I think we've covered, at least for a very quick introductory overview of PolicyMap, most of the features that are available in the tool. I think the upload feature will be very useful for you, and I know that we are in discussions with NNDTA to possibly add New Jersey specific cancer data or possibly some other data sets, because the subscription that's covered under the grant does also provide for a handful of additional data sets that we will load for you. So other than that, you'll have the access to the data loader to load your own address-based data. And if there's no other questions, I think we will end this call. A few minutes early, I'm getting the signal that the questions have slowed down. So yeah. Oh yeah, actually, Brian has offered to read some of the questions and answers. So let me just go ahead and mute and let Brian speak to those. And please type some other questions now as well.
Sure, so I think everybody should be able to hear me. Yeah, it looks like it. So I just wanted to address some of the questions that have come in. So we've gotten just a few questions, and in the responses that I've typed in to kind of the actual questions window within the GoToWebinar panel, I've shared the responses to those questions with everyone, so hopefully everybody should be able to see those responses. But I can also just kind of quickly address them on the call, because I think they are good questions, and I think that they, may just be some useful points to share with the full audience. So we had one question with regards to 3-layer maps. The question was, is it best to use the same geography? So either, block group, census tract, county for all the layers that you're displaying. So the answer to that is, yeah, I think that it is best to use the same geography for all the layers when you're kind of adding multiple layers within 3-layer maps. It just ends up being kind of a cleaner representation of the data, but while that might be sort of the best practice, it's not completely necessary. You can still create a 3-layer map without having all the data displayed at the same geographic level. But what the tool defaults to is displaying the data for the smallest geography. So if you had like a census tract layer and then a zip code layer, what the data would default to show is the data displayed at the census tract level. So that's just an important distinction. The other question was, your cancer data shows cancer rates, which should be specified as either cancer incidence, new cases, or cancer mortality. Deaths, which are the most commonly reported statistics. They did include a comment that from the numbers that they were seeing, that it looked like the data that Tom was demonstrating was cancer rates, not mortality, or sorry, cancer incidence rates, not mortality. So that is, that's correct, that's accurate. So the data that Tom was displaying was cancer incidence. And in my response, I just included a note that when the data that Tom was just demonstrating is displayed on the map, you'll see in the full label for the data layer that it does say annual cancer incidence to kind of make this distinction. But I also wanted to point out that we do have cancer mortality data available in the tool. It's in the health menu under vital statistics, mortality, and then you'll see kind of there's a lot of mortality data. I think Tom may have showed it quickly. But cancer mortality being one of the indicators that's available. Another question was, are the data mostly updated to the latest available? Which indicators are somewhat outdated? Is the American Community Survey data for 2016 up? So the data is, for the most part, the data is updated to the latest data that is available. So our data team here that's responsible for kind of keeping the tool up to date and current, all the data that's available in it, we're usually updating these data sets usually at least annually, if not more frequently. A lot of the indicators that Tom showed come from sources like the American Community Survey that's released annually, and we usually have that updated within a couple weeks when it's released. So the one part of the question about the American Community Survey data for 2016, is that up and available? That is. So a lot of the indicators that Tom showed was the latest American Community Survey data, which we show the data for year ranges, so 2012 to 2016 being the most recent 5-year range data that's available. So yeah, so the answer to that kind of question is yes, the 2016 ACS data is up in the tool. As far as some of the indicators that are somewhat outdated, you know, there are some data sets that sometimes it's the source releases the data only like once every couple of years. Sometimes it's data that is available that's done sort of one time as part of like a one-time analysis, and there wasn't necessarily an update to the data. So like a couple of ones that I can think of off the top of my head are under like quality of life, and under I think the health menu we have grocery retail locations, so the locations of grocery stores. So that data is from 2013. We're anticipating being able to update that with more recent data in the next 6 months. But that has started to age a little bit. And then we do have one education data set under the education menu that was sort of an annual, or sorry, a nationwide performance, that kind of school district level performance data that was a publicly available data set. So we have a couple of education data sets in PolicyMap, and we have performance data from grade schools, which is a data set that we license. But this kind of nationwide school district performance data set was done in 2011, 2012 as kind of an analysis by the New America Foundation. And as far as we know, there hasn't been any kind of funding to renew and to update that data. So that's just kind of another one that I can think of off the top of my head that is starting to get a bit outdated. But yeah, for the most part, everything is sort of the latest data that's available. HIPAA compliant. That's a good question. So one of the questions was, how secure is the data that users upload? Is the security HIPAA compliant? That's actually a question that I would probably want to confirm before providing a response, and we can follow up with kind of any details on that. You know, the data, as far as kind of like if it's data that you load, it's only, and you kind of only share it with you don't share it with anybody, and it's only available to yourself. You know, it's not going to be something that other users of PolicyMap would be able to access or see. We have, you know, just sort of, it is like we have like a security certificate on the site. So you'll see, you know, even in the URL, we have like the HTTPS in the URL. So that's sort of similar to what you would see with like your online banking kind of sites and things like that. So we have a lot of security, but as far as kind of HIPAA compliance, I would have to confirm before giving any definitive answer on that question. So we can follow up on that. Can the maps be exported? Yes, so the maps can be exported as image files or as PDFs. So Tom kind of went through the print function, and he's kind of showing it right now. So there's a little print icon in the top right corner where you can create exportable PDFs of your maps or as image files, which is the PNG option. If you're looking to like embed it into a Word document or report, then PNGs are usually going to be your best bet. And then another question that just came in, how can the custom reports be saved outside PolicyMap? I was only able to save and read on the website, not download anywhere else. So the custom reports, so I think that's in reference to the like the community profile report that Tom showed. So some of the standard reports that are available in PolicyMap. So when you create one of those, once you have it open in PolicyMap, you should be able to see, you should see in the top right corner of the reports page a little save icon. So yeah, so up in the top right corner, you can either save it or you can use the print. So that print button should allow you to basically create it as a PDF. Yeah, and you can go ahead and change the name, which Tom's demonstrating right now. But once you click on print, then same as kind of when you create like an exported map, your browser will pop up and let you know when that report is available as a PDF. And all of these standard reports in PolicyMap are designed to kind of be exported nicely into PDF format. So once you, yeah, so there it is. So, and it'll just kind of come out as a PDF. Yeah, I think you can drag it. Yeah, so there it is. So it'll be available as just a PDF that you can then print or save somewhere locally. And then yeah, the Tom just is also showing the exported map, which is also a PDF file right next to the report. So that's some of the things that you can export out of PolicyMap, along with, as Tom had demonstrated in a couple instances, you can also download data out of PolicyMap as in spreadsheet format. So those are some of the things that you can kind of pull out of the tool. So I believe that's all the questions that we got. So yeah, I think if we don't have any other questions, we could probably wrap up.
Okay, Brian, thanks for answering those questions, and thank you, everybody. And we'll send a note out to everybody. I think everybody knows how to reach us, at least from OCCP. And again, offers out there for NJCEED or other organizations attending. We'd be happy to meet with you and chat with you as well. But in the meantime, thank you again so much, and have a great day. Take care.